Why did the WHO decide to call the coronavirus outbreak a pandemic when they did, and not before? The infectious disease known as coronavirus disease 2019, or COVID-19, is caused by the most recently discovered coronavirus, first detected in China in late 2019. The WHO Director General stated that the new virus was the first coronavirus to spark a pandemic. It is the virus we've all been dreading. By the 11th of March, when the WHO Director General declared COVID-19 a pandemic, the outbreak had already gained a foothold in the majority of countries, and many commentators had long been thinking of coronavirus as a pandemic. The problem is, no official category exists for a pandemic, at least not anymore. A pandemic is an epidemic that occurs on a global scale, crossing country boundaries and affecting large numbers of people. Pandemics can occur in plants, wild animals, livestock, and humans. A disease must be infectious to be categorised a pandemic. It is not enough that it be widespread or that it kills a lot of people. So many of the leading causes of death in the world are not considered pandemics. Nevertheless, pandemics such as virus pandemics are of particular concern because they potentially affect all sections of society at once, including health workers, and also many countries at once, and therefore can hamper public health responses and international relations, with the imposition of travel bans, for instance. On the other hand, they can galvanise global effort towards an effective response, such as the development of a viable vaccine. The World Health Organization used to apply a 6-stage classification system to describe virus outbreaks as they progressed from the first few infections to full-on pandemic, which people may be familiar with from the H1N1 outbreak in 2009. The WHO phases included an interpandemic period, a pandemic alert period, and a pandemic period. Phase 1. No new influenza virus subtypes have been detected in humans. An influenza virus subtype that has caused human infection may be present in animals. If present in animals, the risk of human disease is considered to be low. Phase 2. No new influenza virus subtypes have been detected in humans. However, a circulating animal influenza virus subtype poses a substantial risk of human disease. Phase 3. Human infections with a new subtype, but no human-to-human spread, or at most rare instances of spread to a close contact. Phase 4. Small clusters with limited human-to-human transmission, but spread is highly localized, suggesting that the virus is not well adapted to humans. Phase 5. Larger clusters, but human-to-human spread still localized, suggesting that the virus is becoming increasingly better adapted to humans, but may not yet be fully transmissible. Substantial pandemic risk. Phase 6. Pandemic phase. Increased and sustained transmission in general population. In February 2020, however, well into the outbreak, the WHO announced no official category exists for a pandemic, and that for the sake of clarification, WHO no longer use the old system of 6 phases of a pandemic outbreak. It remains to be seen how much of the response to the coronavirus has been influenced by a desire to allay a public panic, especially in the light of the fact the WHO don't like to call coronavirus by its scientific name, SARS-CoV-2, for fear of alarming the public after the deadly SARS outbreak in 2003, with concern increasing in many countries such as the US and in Europe that members of the public not taking the threat seriously enough is leading to more spreading and more deaths. This may have been a mistake.